Hello, my name is Dr. David Tucker. I'm the Chief of Staff here at Ozarks Community Hospital in Gravette and been a staff physician here for many years. March is Colorectal Cancer Awareness Month, and as all physicians, I strongly advise all of you to get your screenings in. Colon cancer is one of the largest causes of death from cancer in the United States, affects both men and women. It's real important to do so. I had two very good uncles that died of that at a young age, and I think if the screening would have been available at that time, that many years ago, they'd probably still be around today. 1 out of 20 people in the United States will develop colon cancer at some point in time in their life, and everyone is really susceptible to it. There are a few things that will increase your risk for it, such as being overweight, smoking, and a strong family history of colon cancer. And those people should probably be screened more aggressively and perhaps even sometimes more often. However, everyone should receive colon cancer screening because everyone's at risk for a polyp, which is a small overgrowth of tissue that over a period of time, sometimes many years, will gradually increase in size and develop into cancer. Colonoscopy is a great way of removing those polyps early on before it ever gets to that stage. As I said, colon cancer is one of the most common forms of cancer in the United States, the third most common in both men and women, the second most common cause of death. You don't go to bed normal one night and wake up with cancer the next night. It takes a long time for the cancer to develop from a very small abnormal growth into a polyp and then into cancer per se. And the goal of colorectal cancer screening is to find these polyps at an early stage, long before they turn into cancer, where they can be taken care of and treated only with a minimum amount of effort. A lot of people don't get screened because they feel they don't have any symptoms and that they feel perfectly fine. The number one symptom of early colon cancer is nothing. And people with polyps that most of the time have no symptoms. And that's why it's important to get the routine screening to find that. Certainly by the time you start having symptoms such as abdominal pain, rectal bleeding, or weight loss, the cancer is already either developed or getting close to develop. So that's why it's very important to be screened before any of these symptoms develop. Previously, the American Cancer Society recommended that every American get colorectal screening and colonoscopy at age 50. Presently, however, they have changed their recommendations to age 45 and even down to 40 in some high-risk groups. Reason being is that cancer is being discovered more often at an earlier stage, and we're starting to notice increased incidence of polyps at an earlier age, and treating those polyps at an early stage is most beneficial for long-term survival. The top 3 present ways of screening for colorectal cancer is checking your stool for occult blood. Oftentimes when you go in to get your yearly physical, if you're above a certain age, your doctor will do that test and let you know that there's no blood in your stool. Unfortunately, not all polyps and all cancers bleed every single day. So it's important to have several of those cards done at each time you do that. A little bit better is the DNA tests that are now available. If you get sent a kit, you provide a stool specimen, send it off to the company, and they analyze it for any DNA changes that could be from polyps, from cancer, or anything else. One of the problems with that is it's not real well covered by a lot of insurance companies yet. It's relatively new, but I think as time goes on, it probably will be better covered in the future. So check with your insurance company on that. One of the drawbacks to that, if it does show up being positive, then you have to go to the third screening method, which is colonoscopy. That's a screening tool that's provided in most places, where we use a small scope that goes up and takes a look at the inside of your colon to biopsy any areas that could be abnormal, and actually can treat early colon cancer by taking out these early polyps. Nowadays, the scopes are much smaller than they used to be. People have a fear of pain associated with it. However, there's no pain associated with the procedure at all, and is very well tolerated by everybody. The best news about colonoscopies is that they're increasingly being covered by all insurance companies. Pretty much everyone over age 50 is now covered, and we assume that will go down to age 45 soon. And almost all insurance companies will cover routine screening, even on low-risk people, every 10 years. Every day, physicians hear excuses from patients why they don't want to have a colonoscopy. One of the biggest ones is that they say, I feel fine. Well, of course you feel fine before you get cancer. And that's when you want to take care of things before you start having any symptoms. A lot of people feel that I don't want to have anything that's going to be potentially painful. Not painful at all. The anesthetic people are there to help take care of things, and patients do not feel anything with the colonoscopy. Even taking off the polyps and that, there's no pain associated with that. A lot of times they say, I'm just scared in general. Nothing to be scared of. Something that physicians do all the time. All physicians are fairly, that perform colonoscopies have done thousands and thousands of them. They're fairly well versed in them. So really, one of the things you might even consider, talking to family members who have had it done before. I tell my patients that the worst part about it is the prep the day beforehand. You feel nothing during the colonoscopy. And the prep has gotten much simpler over the past few years. A lot of people don't want to go through that kind of prep again, but they had a colonoscopy maybe 10 or 15 or 20 years ago. It's actually much simpler than it used to be. And really, I haven't had a patient complain too much about the prep in quite some time. This is the colonoscopy suite here at Ozarks Community Hospital in Braddock. You can see the equipment that we use on a weekly basis. We do colonoscopies in this room every week. I've been here 35 years now and have estimated done between 4,000 and 5,000 colonoscopies. The equipment we use now is much better than the ancient equipment we used to use in the old days. And I guess that makes me appreciate still being an old physician. I can remember some of those old things. If the process here at Ozarks Community Hospital is very easy. You're admitted by one of our good admission nurses. You have an IV started. You may have a little bit of other things that they'll ask you to do. You're brought into this room, given a very nice sedative by a great anesthetist, and you won't remember anything happened to you. You get taken back to recovered room, and most people wake up within about 20 to 40 minutes or so, and then go home. The whole process from start to end generally is about 2 to 3 hours at the very, very most. And 100% of people that have a colonoscopy are back to work perfectly normal the next day. Nationwide, colonoscopies dropped 90% during the recent COVID pandemic, and screening for all types of cancers dropped significantly as well. The COVID pandemic has affected all of our lives in many, many ways. It hasn't affected cancer at all. Cancer has been bothered a bit by it, so it's going to happen if it's going to happen. We recommend that everyone start catching up on all your cancer screening procedures, especially colonoscopies here, now that life is getting back to normal. Colonoscopies are available here at OCH. But whether you're an OCH patient or not, please talk to your physician about getting your routine colonoscopy and other cancer screening scheduled. If you do not have a regular physician, call the number on your screen to start that process.